Namaste to all. I am Meena Paudel from Nepal Disabled Women Association. I am co-founder and now serving as a general secretary. It's my honor to be a part of this online CRPD side event to launch the Photo Voice study. Our organization was one of four Nepali organizations of persons with disability involved in this study. Women with disabilities in Nepal are more vulnerable as compared to women without disabilities. They are facing multiple barriers and problems not only because they are women but also due to their disabilities. Women with disabilities are less likely to access formal education and achieve higher level education. Illiteracy rates are higher for women with disabilities. Women with disabilities generally have more health problems than women without disabilities as they have limited access to comprehensive health and rehabilitation service, particularly in rural and remote areas. Women with disabilities face difficulties accessing sexual and reproductive health, including menstrual health hygiene management. Women with disability experience stigma, prejudice, and marginalization which exclude them from daily life. This puts them at greater risk of violence and abuse. Intersectional discrimination is also an issue, in particular for women and girls with disabilities. Women and girls with intellectual or psychosocial disabilities and women from ethnic Dalit, Madhesi and Muslim communities. According to the research conducted by NDWA, over two-thirds of women experience violence said that their disability was one of the main causes of the violence against them. 64% of women who experience violence said the violence was perpetrated by family members. Women who reported experience violation reported psychosocial problems. Women with disabilities face social, cultural, political, and religious exclusion. Over a third, 40% of the women who were unmarried reported that the main reason for not marrying was due to their disabilities. Women with disabilities who have experienced violence face multiple barriers in accessing justice. The majority of women with disabilities in this research who said their experience violence didn't reported the abuse to anyone, including the police or any other local organizations. There are no authenticate disaggregated data of women with disabilities which affect on proper planning, inclusion and participation of women with disabilities in all spheres of development. Women and children usually are the ones who suffer the most during the disaster situation, especially those with disabilities. Even when we talk about the current COVID pandemic, women with disabilities face and are still facing significant barriers to protect themselves from its impact. Many have been reduction in income and increased food insecurity. The negative effects of COVID-19 are compounded for marginalized groups within disability communities. Therefore, effective implementation of national and international measures is needed for the empowerment of women with disabilities. Organization of persons with disabilities should be involved in all development programs to ensure of women and persons with disabilities. National and international organizations need to partner with them on the issues of disability and involve them in every activities. Cooperation and coordination of international organizations is crucial to achieve the goal of leave no one behind and also essence of sustainable development, and also for the socio-economic, political empowerment and inclusion of women with disabilities, for gender inclusion as well special attention should be paid to women and girls with disabilities. Nothing about us without us. Thank you very much.